How do you navigate working out when your joints hurt? So often when people don't feel well as far as their knees aching or their shoulders bugging them or even their back not feeling great, the option that they are presented with is to not work out, to abstain from working out, and maybe to try some other things before they try working out. But there are some very specific things you can do with your workouts to not only help improve your strength, but also possibly help you start to feel better. That's exactly what we're going to be discussing on this week's episode of the Exercise is Health podcast. We're going to cue our introduction and then we're going to dive right into this conversation. Hey, welcome back, exercisers, to the Exercise is Health podcast, brought to you by Exercise for Life Studios, where we believe that your health is your most valuable asset, and the single best thing that you can do to both boost and protect this asset is exercise. Specifically, exercise is geared towards building the health and function of your muscles. We are your hosts, Charlie
and Julie,
and today we are discussing this idea of what can you do if your joints are hurting, but you know that you still want to work out. How can you use your workouts in a way that is respectful to your body and respectful to what your joints are feeling, but not make things worse while still being able to improve your strength, improve your fitness, and everything like that. There is a very distinct process that we want to walk you through to help you do that, and that's what we're going to be discussing on today's episode. But before we do, we have a favor to ask of you.
That's right. If you've enjoyed our podcast today or for the last 5 years, we would love it if you would pause the show now, scroll to the bottom, and give us a rating and review. Little do you know, this is the number one thing that you can do to help us out, help grow our podcast, grow our platform, help more people, and get more and more amazing guests. So please pause the podcast now, leave us that rating review. It would help us out so much.
So I just want to preface today's conversation is that the people that we are speaking to are ones who have been cleared for regular exercise by their physician. We are not asking you to override what your physician is saying or anything like that. But if you have been told that, hey, you should be exercising, but in your mind you're like, I don't know because my knee hurts or my shoulder hurts or, this, that, or the other part of my body hurts, we want to lay out a framework that you can follow to help you exercise without making things worse and possibly nudge your body in the direction of better. So I just want to start with that disclaimer so you understand kind of where we're coming from with this. But Julie, I do have a question for you that I'd like to ask you. Okay. So out of all the people that you've worked with in your career, percentage-wise, what percentage of them at some point have complained about a joint issue?
100%.
Right? And that's really what it is. Like, I don't know that I can think of anybody that I've worked with, since 2010 that has not had some kind of joint complaint at some point. It doesn't mean it's a chronic issue, but at some point they might say, my knees are feeling a little bit sore today, or my shoulder's a little bit sore. There's this thing going on with my neck. It's just something at some point. And I think if we're being honest with ourselves, like, we have all experienced something like that at some point as well. So Julie, here's a follow-up question to that.
Okay.
How many of those people, or like percentage-wise, would you say, yeah, it would have been a good idea if they were still exercising, even if there was some joint thing going on?
100%.
Right? And that's really the thing, is so often when we talk, your knee is, there's this issue going on with your knee, or there's this issue going on with your shoulder, or maybe it hasn't been diagnosed or whatever, but you're just feeling something. We use that as a reason to not exercise, and not just not exercise that area, but not exercise for our entire body. Everywhere, right? Yeah. And I mean, obviously, like, if you're listening to our podcast, you understand that there are issues with that, because we've said so many times that you only get the health benefits of exercise if you exercise in the first place, and you're only able to keep getting those benefits if you are able to keep exercising. And so here's the thing, if your shoulder's bugging you and that's a reason why you're not working your entire body, you're not exercising at all, well, we want to talk with you and say, hey, you know what, there are actually some things that you can do, not only just for the rest of your body, but a way to go about working with your shoulder, again, as long as you've been cleared, that may actually not flare it up, but actually help to nudge it back in the direction of feeling better.
Yeah, there's very few instances that I can think of that your joint pain, back pain, foot pain, any of those areas that are joints, even if basically everywhere in your body has a joint. Mm-hmm. If you think it moves, it has a joint. So for example, I bring up backs because a lot of people don't think your back is a joint, but it's like a series of joints, right? But anyways, there are very few instances where I feel like, okay, your discomfort there is the reason you shouldn't exercise. Probably the only reason is if you've just finished like a marathon and you like literally need to rest.
Sure.
But if you woke up with a sore back or you've woken up with a sore back for the last 5 years, it's a really great reason to exercise. And even if you're worried about, your back bothering you when you're exercising, we're going to give you some really great tips that we use all the time in our professional practice. But at the same time, you also need to keep everywhere else healthy. Your elbows aren't bothering you. Let's keep those healthy. Your wrists aren't bothering you. Let's keep those healthy. Your knees aren't bothering you. Let's keep those healthy. Sometimes, like what Charlie was saying, we use the one area that might be bothering us as a reason to let everything become deconditioned. But I want you to consider this, because a lot of people don't. Some of you already do, and some of you don't. But consider this, that exercise might and generally does help decrease the sensation of pain in your body. Now, we can't claim that exercise is a solution to your pain because we are not medical practitioners, and exercise is not technically a medical drug that can be used to treat pain. You have to go to a physician for that and a pharmacy for that. But we know lifestyle and how you're exercising really highly influences your experience of pain. And in my opinion, if something changes my experience of pain, then it's working on solving that problem. And another thing to consider that many people don't, that we talk to our clients about all the time, is that, we don't get to control like when we feel pain. It's not like a switch like on my shoulder, like, oh, today I'll feel pain, I can handle it. And then I just need to go to like the chiropractor and they'll just switch the flip off. It's not, we can't really fully control our sensation of pain, but we can control what we're doing with the rest of our body, right? Things like, am I participating in exercise? Am I keeping my muscles strong? So a lot of times, one of the first steps that happens when you exercise and you're experiencing joint pain is that you notice your body can do a lot more. It's stronger, it's more conditioned, and your pain doesn't get worse. Usually it's getting better at the same time, but sometimes there's a delayed response for people. So always knowing like, hey, also if I can do more stuff with my body, I'm more capable, I'm not as limited, then that is also a sign of improvement relative to the current condition of your body. We actually interviewed some pain physicians and they mentioned the same thing, that a big thing in helping people deal with pain lifestyle wise is improving their ability to do stuff, improving their strength, improving their conditioning, improving their, physical activity level, even when they're experiencing pain, because that really, really helps with the entire process of increasing their ability to live life even when they have joint pain.
Yeah, Julie, you bring up so many good points. I want to touch on the first one and then the last one that you just made, okay? The first one being about like us not claiming, that, okay, exercise will definitely, reduce your pain or anything like that. Well, we have had, a pain specialist doctor on our podcast twice with Dr. Dave. And, he runs a pain management clinic. His specialty is helping people, navigate not being in pain without the use of opioids. And one of the primary things that he talks about is the importance of exercise, even when somebody is in pain. And so I wanted to bring that up because it's not just like our opinion, like some of the leading like medical providers that are helping people, manage their pain, even, without using drugs, are saying, no, exercise is the thing that you need to be doing. Number two, I really liked that you brought up the point that was also brought up by Dr. Dave and Dr. Kostas when we interviewed them on our podcast, is a lot of times we feel like pain is more severe than it is when it limits our ability to do things in our life. And so when you can improve your ability to do things throughout your life, the pain may not seem like it has as detrimental of an impact on your day-to-day actions. Like, yes, your back may still be bugging you, but if you can get up out of bed, if you can do the things that you want to do, and even though the discomfort is there, it doesn't seem so prohibitive versus, if it's stopping you from doing a whole bunch of things. And so that's where they talk about, hey, like exercise to improve your strength, improve your fitness, improve your conditioning can be such a useful useful tool so you can keep doing the things that you want to do, even if things aren't feeling the way they want to feel. So those are two really great points. And I just want to back it up again that we've had medical professionals who are saying those exact same things. And that's how they go about helping people who are trying to navigate, chronic pain or severe pain or whatever, but without the use of opioids, without the use of drugs.
Yeah, when pain is stopping you from doing stuff in your regular life, it's a big deal.
Mm-hmm.
And that's where we see people's mental health start changing about their pain. I actually just had a very micro experience of this because I decided to test out some new shoes and it caused me some pretty intense ankle discomfort. And so anyways, I've switched out of them. I'm fine. But for about a week and a half, I had some really intense ankle discomfort. And I was just thinking to myself, I was uncomfortable walking around, and the place where it was the worst was walking downstairs. And I was walking downstairs sideways because of my new shoes. Anyways, I was just thinking, wow, that experience of okay, I really need to do something about this because I have stairs in my house, was urgent. I was I gotta be able to do stairs. I've got little kids, all these things. But if I didn't have stairs in my house, I probably would have kept trying my new shoes for a lot longer because it wasn't limiting me from doing anything in my life if I lived in a ranch house with no stairs or something. So anyways, I just thought that was a very recent micro experience that I just had with thinking, okay, what are the requirements of my life? Stairs, and this ankle thing is making it so I can't do the stairs. But when you think about your lifestyle factors, thinking about what am I doing each and every day, and is my pain limiting me from doing that? Sometimes just getting the exercise going, really, number one, reduces pain, and it can also increase your strength and conditioning. I think a lot of people downregulate or are not aware of the huge implications of having conditioned, strong, ready to go muscles, and how that will impact your life and how you're able to live your life.
Absolutely. So if you're hearing this right now, you're thinking, okay, but every time I exercise, I always feel lousy after, I always feel like I'm in more pain. Look, the vast majority of the episodes that we put out in this podcast are discussing how to avoid feeling lousy after you work out. That's kind of the general end goal, right? Today, what we're talking, so we'd invite you, if you're thinking that, we'd invite you to go back and check out any of the 300 plus episodes that we've put out to really kind of learn these strategies and tactics that you need to implement so you don't feel achy, sore, beat up, or borderline injured after you work out. What we're talking about today is if you are walking into your workout and your body's already hurting, how can you change what you're doing and how you're doing it so your workouts don't make you worse and start to nudge you towards feeling better? So that's the distinction that we want to talk about today. And the first real big thing that we want to make sure that you're doing is that you're actually moving consistently throughout your day. One of the fastest ways to get weaker, one of the fastest ways to lose conditioning, both of which are going to make your pain seem more severe because it's going to limit your ability to do the things you want to do in life, is to be very sedentary throughout your day. Now, you might be hearing this if your knee is really bugging you. It's okay, yeah, but getting up and moving throughout my day, that hurts. That bugs my knee. And I get it, right? So the thing is we want to try to figure out ways that you can still stay active throughout your day, or at least have the intention of staying active throughout your day. And there are a lot of ways that you can stay moving, stay active throughout your day that don't have to involve or stress the joints that are bothering you as much. And so it's going to be a lot of trial and error and exploration to figure out what's working for your body. But we want to put that as step one, as some encouragement of look, if your knee's bugging you, if your feet are bugging you, if it's something where it's just getting up and moving really doesn't feel good. The only time when I feel good is just when I'm, being still. It's for a very short period of time, that may be an acceptable place to be. Your body just might need you to be still for a very short period of time. But if we're talking that's going on for more than a week, 2 weeks, longer than that, then you are definitely losing strength, and you are definitely losing conditioning, and ultimately you are definitely losing the ability to keep doing the things that you want to do. And so it's of the utmost importance that we make sure you're getting up, you're moving around consistently throughout your day. Even if it's not completely pain-free, you can find ways of doing it that are less uncomfortable than others. And so we want to invite you, encourage you to start beginning to explore those options.
Yeah, and even if you have to think outside the box, like something silly, like maybe your knee's bothering you, so multiple times throughout the day you can sit in your chair and straighten it and bend it. That's a great way to keep your knee moving. And then for the rest of your body, remember, it's not just about the one area of pain, it's about keeping your whole body conditioned. Get up, maybe get some crutches or something, and hobble yourself around the office and make sure you're getting, because it's still movement, even if you're not walking, right? So being creative with what you can do that's going to feel okay is going to help you heal. Charlie, I was just thinking of this difference. So, a lot of people, when they exercise, they think of like sports. We talk about this, and we don't recommend that you exercise like an athlete, because athletes are paid people to push their body to the limits, right? That's what they're paid to do. But what I was thinking would be interesting is, what if we all tried to recover like an athlete? So Charlie, you work with professional athletes. When you hear about your athletes getting injured and maybe they're out for a couple games, meaning maybe their income has changed or their potential for professional progression has changed because they're not physically, playing, are they resting for weeks and days and months on end, or are they getting after it with doing stuff, getting the mobility, getting the motion throughout their day? What are they doing?
So I'll say this. When I worked in a team environment, the guys that had more issues going on, that were unable to be on the active roster and then unable to play in the games because of aches, pains, or injuries, their days in the the training room and stuff were way more intense than everybody else's. Not even close. Way more intense. They're doing so much more to try to get their body back to the point where, okay, now they can go out and play. Now they can go out and perform. I think a lot of times, like you're saying, Julie, there's this idea of okay, well, I hurt myself. I just need to rest and recover. And it's almost like promoted as, well, that's the acceptable thing to do, within it. Oh, you're not feeling well. Okay, yeah, take a little bit of time off. And, a little bit of time doesn't mean a day. A little bit of time means a week or 2 weeks. I just need a little bit of time, meaning I need the next month to myself to just kind of, it's no, come on. All right, you need a day or two. Okay, cool. Take your day or two or whatever. But then you need to actively start trying to get yourself functioning better, stronger, in better fitness condition, everything like that. That's what the people who are trying to perform at the highest level are doing without question. It's a very intense recovery process because, yes, while there may be the one part of their body that's injured, the whole rest of their body is fully capable. And believe me, they are working those areas of their body. Yeah,
I just thought that was interesting. And I was thinking of that because I was thinking, what if, $100,000 rested on you getting your knee back, especially when you're working with guys still on the sub level of the NBA, they're really trying to get to that next level or whatever level they're at.
Well, it's almost like what if you could get fired from your life?
Yeah.
Right? No, but seriously,
yeah.
What if what if your children could come up to you and be like, yeah, we're firing you as the grandparent because you're not physically able to pick up the kids because your shoulders are bugging you or something like that, right? That feels whoa, that's kind of personal, Charlie. That's
yeah.
a little heavy. But here's the thing, is if that were actually an option on the table, and that was a thing that was okay, I actually need to do something about this now, you'd probably go and do something about it because the thing that matters most to you is now in jeopardy. And when it gets to that level, now it's okay, yeah, I'm going to find a way to do this. And so we're kind of kicking off with this just so you can have the mindset, approach this with the mindset of okay, there's something that I can do about this. I just don't need to kind of sit back and be oh, well, my knee's bugging me, so I'm just going to take the next month off from working out. It's no, there's something that you can do. Not necessarily, we're not talking about the knee specifically, but there's something you can do to work the whole rest of your body, okay? And you can go and start to exercise and bring up your conditioning, bring up your fitness, bring up your strength, and that will help support the recovery of the knee to make sure that you can get back to then doing all the things that you want to do.
Yeah, and I think Charlie and I are so passionate about this because this is what we work with all the time.
Mm-hmm.
Like, if you could exercise any way you wanted and never got injured, don't feel any pain, then you probably would never seek out someone like Charlie and I. We wouldn't have any problems to solve for you. And so we see it all the time that you have some kind of joint issue, some kind of joint pain, and exercise is an amazing, if it's not the solution, it's an amazing supporter that gets you a long way, and it really helps you live your life. So let's jump into the tips of what you're doing with your exercise. So we already talked about tip number 1. You got to move throughout your day. You got to be creative. If you can't walk, you're doing something else. Figure out how are you going to move your body and that joint, again, if it's cleared for exercise, move it throughout your day. And we're talking gentle. We're not thinking like go harass it, go do some CrossFit with your, whatever. You're doing something gentle, like you're walking to the mailbox, you're moving around your office, you're setting a timer so you get up every 30 minutes and just get some general movement. Get a little bit of blood flowing, get mobility through the joint. The next thing is going to be applied to your resistance training. So we know that when muscles are more conditioned and when they're stronger, they do an amazing job at supporting joints. That's like one of their main roles. They move and support joints. They hold joints the way they should. We know that it helps arthritis when joints are stronger. When muscles are stronger, we know it helps joint pain. We know all these things. So now we need to strengthen, right? But when we think of strengthen, a lot of people think of, again, like athletics. And they're like, well, I can't do that. Again, I'm listening to this podcast because I have joint pain. So remember, we have a very different approach to how you strengthen. So here, we're going to give you our top 2 tips for applying to the how. So don't train like you're training to be on a football team. We want you to train with certain principles. So when you do your resistance training or your strength training or your weight training, whatever you like to call it, you want to make sure that your range of motion that you're using is either 1, symptom-free, or 2, does not increase symptoms. So let's say you have knee pain and you're like, well, I can't do any range of motion without pain because I have knee pain. And some people don't have knee pain until they start moving it. So you just have to figure out what category you're in. So either 1, you're going to move as far as you can with no pain, no pulling, no stretching, no zinging, no funkiness, no clicking, all that junk. Or you move as far as you can without increased pain. So you'll notice sometimes, like every time I move my knee, it's a little bit uncomfortable. Okay, so you move as far as you can, but make sure that no discomfort increases as you do that movement, and stay within that range, and be open to the idea that that range might change. So when you stay within your pain-free range of motion or not increased pain-free range of motion, and that's what we call respecting your range of motion. So you're saying, hey, body, this is what you're telling me we can do. Let's do that. And the more that you get stronger in that range, the more range your body has the opportunity to give you. Now, contrary, a lot of people think that I actually have to force range that I don't have. And that is the big thing that sets people back. The number one reason why people leave their exercise and feel bad, they always think it's because they did too much weight. But it's almost always because they've done too much range. And it's mostly because their brain is telling them, well, my knee can't go straight. My knee should go straight, so I'm going to force it straight. Or my arm can't go up to 90 degrees. It should go up to 90 degrees, so I'm going to force it up to 90 degrees. Don't do any forcing. Always respect your range of motion and strengthen what you do have. And that's how your body will give you more range of motion.
Now, Julie, I remember last summer when I hurt my shoulder, I was, it was painful, like right from the get-go. Mm-hmm. And I remember that day, I still actually went and lifted my upper body, meaning I did exercises for my shoulder. But what I changed, not necessarily was the exercise I did, I still did all the exercise I'd normally do during my workouts, even though my shoulder was hurt. I changed the amount of motion that I was using, because even though like from the get-go it was painful, there were parts that were more painful and parts that were less painful. And so I just started by staying in the part of the motion that was less painful. And so I just stayed within that. And what I actually found is over the course of that one workout, the amount of motion that I could use without increasing the amount of pain, it increased. Like the amount of motion increased that I could move through without having the pain increase. And that was a large part of kind of getting my shoulder back to feeling better, getting my shoulder back to feeling stronger, was this first tip of staying, or this second tip rather, of staying within my symptom-free or not increasing the pain, that part of the range of motion. Now, if you're familiar with our 4 exercise for life principles, you'll recognize this as the first exercise for life principle. And while all of them are important, it's really this one and one other one of the exercise for life principles that we want to highlight for you today, because we find that these 2 end up being the most impactful. So the first is staying within your symptom-free range of motion, or the part of the range of motion that doesn't increase the amount of pain if there's already that kind of that baseline level there. The second tip, or the third step of this process, the second part from the exercise for life principles that we want to discuss, is to make sure that you're moving slowly. Okay, one of the easiest ways to violate the amount of motion that you're using is to move too fast. One of the easiest ways to flare your body up and not feel well because of your exercise is to move too fast. All right, and so in order to avoid all that, in order to give you a better chance of staying within your symptom-free range of motion, we want to ask that you move slowly, okay? Slowly, remember, is not necessarily a time thing or a tempo thing, but rather a control thing, okay? You're moving at the speed with which you can stop immediately, okay? And the reason why that's important, especially if there's some kind of discomfort going on, is because as soon as your body doesn't start to like something, you need to be able to alter what it is you're doing. And so you have to be able to stop the motion and then change how you're doing the exercise, because otherwise you're going to, if you continue to do the exercise in the way that you're doing it, it won't be until the end of that set or the end of your workout where your body's just yelling at you saying, yeah, you know what, that stuff that you did for the last half of the workout, we weren't liking that. So you want to be able to interpret and hear those messages sooner rather than later. And one of the easier ways to do that is to make sure that you're moving slowly.
You know, Charlie, sometimes when I'm like being kind of loud at the office and you're trying to focus, you like put on these like ear thingies
all the time.
Yeah, we have like these noise dampening earphones, and Charlie puts them on so that he doesn't have to hear me like, you know, whatever, yapping or, you know, singing or whatever is happening here. But anyways, I was just thinking of that because moving fast is like putting on sound dampening earmuffs. And I'm saying this because your body talks to you when you're going to exercise. You're going to feel muscle squeezing. You're going to try to feel for what a lot of people say, like you're listening to your body for zinging, pain, anything that's telling you is going wrong. And the best way to miss all of those communication signals is to move quickly, because your body won't be able to sense it in time. So it's almost like when Charlie puts on his ear dampening headphone thingies so he can't hear the loud stuff going on here at the studio. When you move quickly, you put those earphones on, but you want to actually have them off so that you're actively listening to your body. Now, when we exercise, your body sends a lot of communication. The only sensation that we know is good is if you're feeling muscles squeezing, or if you start feeling that onset of fatigue. That just means like you're getting to a decent level of contraction and fatigue in your muscles. So those 2 things are okay to feel, which some people call that sore or pain or whatever, but that's like from muscle work, right? But what we're looking for is that negative stuff, like pain, zinging, pinching, sharpness, any of that kind of stuff, or even stretching. We don't want to feel stretching or pulling when we're doing exercise. Squeezing and contraction are fine. So anyways, you want to take off your your sound dampening headphones. You want to listen closely. And the way you can do that is to move slowly every time you do your resistance training exercises so that your body gets to have the opportunity to communicate with you.
So if you have a joint that's bothering you, and again, you've been cleared by your physician to exercise, your physician says, hey, you know what, one of the big things you can do right now is, you know, start working out, start getting it stronger, and you're not sure how to go about doing it, Start by following these 3 steps. Make sure you're moving consistently throughout your day. When you're doing your strength training, stay within your symptom-free range of motion, or the part of the range of motion that's not increasing the symptoms or the pain. And make sure that you're moving slowly while you're doing your strength training. Not only will this help you to strengthen the areas that aren't feeling as well, but it will help you to strengthen the rest of your body as well, which will help you to keep doing all the things that you want to do, which again is a primary concern that a lot of people have as far as like why the severity of their pain is taking such a toll on their life, because it's prohibiting them from doing the things that they want to do. So independent of the pain, if you're able to get your strength up, get your fitness up, get your capabilities up, and you're able to do the things that you want to do, for most people, the pain doesn't feel as severe simply because of that. Now, if you're looking for guidance on how to go about doing this, one of the programs within the Exercise for Life membership is called Healthy Muscles, Healthy Joints. And within that program, we show you exactly step by step how to go about structuring your exercise and structuring your workouts to make sure that you are applying these principles and taking advantage of this process that we laid out today. So you can get into this program for free, get started today, and have access to it for a full 2 weeks by going to www.exerciseforlifestudios.com. So who do you know that needs to hear this episode? Who do you know that is avoiding working out because one area or one joint within their body is not feeling so hot? Share this episode with them so they can understand how to go about structuring their workouts and what they should be doing throughout their day to make sure that not only they're able to get their workouts in, but their workouts don't make them feel worse in the process. And while you're online, head on over to Apple Podcasts and leave us a rating and review. It helps people find our podcast when they're looking for information on exercise and they're looking for information on health. So if you found value in this conversation today, let us know by leaving us a 5-star rating and review. Well, thanks so much for tuning in. We always appreciate it. Have a fantastic week, and we'll talk with you all next week. This podcast is for information purposes only. The statements and views on this podcast are not medical advice. This podcast, including Julie and Charlie Gates, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements or advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein. If you think you have a medical issue, consult a licensed physician.